Hello, I am Chance Queen, and I am a third year physician assistant student, and I chose to do my master's project on polycythemia because on my second rotation I was given a CBC with only an elevated hemoglobin and hematocrit and asked to interpret it. I also chose polycythemia because I have a couple of pilots in my family. Throughout this presentation, I will cover the general features, clinical assessments, diagnoses, treatment, and prevention for polycythemia. The underlying cause of polycythemia is an increased red blood cell mass, which we see on lab work as elevated hemoglobin and hematocrit. Polycythemia is broken into a primary and a secondary polycythemia. Primary polycythemia, also known as polycythemia vera, is caused by a JAK2 gene mutation in the bone marrow that leads to an overproduction of red blood cells. Secondary polycythemia is most commonly caused from someone being in a chronic hypoxemic state, which we typically see in patients with COPD, airline pilots, people who live at high altitudes, and smokers. Other causes of secondary polycythemia include erythropoietin-producing tumors like renal cell carcinoma and hepatocellular carcinoma. The signs and symptoms of polycythemia are often missed due to their vague character and misinterpreted for things like viral illnesses and dehydration. As well, these symptoms are common for many conditions, prompting further workup and need for laboratory testing. One symptom that sticks out for polycythemia vera is pruritus of the skin after a hot shower. As for physical exam, a lot of the times it will be normal. If an individual has COPD, you may see common symptoms like clubbing of the digits and increased work of breathing. The physical exam plays a part in signs and symptoms because the patients can look tired or very fatigued. When it comes to diagnostics, our golden ticket is an elevated hemoglobin and hematocrit on CBC. Men will have a hemoglobin of greater than 16.5 and women greater than 16.0. Next in diagnostics, if needed, would be an erythropoietin level because typically we see low erythropoietin levels in primary polycythemia and high erythropoietin levels in secondary polycythemia. If primary polycythemia is suspected, you would then move forth with JAK2 gene mutation testing and then further with bone marrow biopsy testing. As for secondary polycythemia, you can do pulmonary function tests and chest x-rays if suspected COPD as the cause. If a carcinoma is suspected, mass biopsies would be the next diagnostic test. Managing blood levels is important for patients with primary polycythemia, so phlebotomy is needed to maintain a goal hematocrit for men at less than 45% and less than 42% in women. Phlebotomy is typically done weekly or biweekly until the goal hematocrit is met. With successful treatments, individuals may only require less than a month of treatment. With primary polycythemia, individuals are at higher risk for thrombotic events, so daily dose aspirin helps reduce the risk of primary polycythemia. Secondary polycythemia is best treated by managing the underlying source. If you limit hypoxia, levels will most likely return to baseline. If a carcinoma is causing the elevated hemoglobin and hematocrit, removal of the carcinoma should return the labs back to baseline. Limited studies have shown that for patients with COPD and polycythemia, long-term oxygen therapy could improve their diagnosis. Unfortunately, primary polycythemia is unpreventable due to being a certain gene mutation of the JAK2 gene. Treatment with phlebotomy to keep blood levels down will help with symptom prevention. For secondary polycythemia, the best prevention is managing the underlying conditions. Symptoms and abnormal lab values can be kept to a minimum if the cause is treated. Smoking only leads to a more hypoxemic state, so smoking cessation is critical for the improvement and prevention. Here are my references. Throughout this presentation, we talked about the differences between primary and secondary polycythemia in their general features, clinical assessment, diagnosis, treatment, and prevention. For recap, polycythemia refers to an increased red blood cell mass that can be caused from the bone marrow disorders or external factors. Hemoglobin and hematocrit are your key lab values when polycythemia is suspected. Thank you for watching, and I hope you have a better understanding of polycythemia.